Myself, Ankush Gupta from Collegedunia. Today we have Dr. H.B. Gowdappa from JSS Medical College. Good morning, sir.
Morning.
So, talking about JSS Medical College, it's an eminent medical education institute located in Mysore. It was established in 1984 and is in the lush green campus of 43 acres. JSS Medical College is now a constituent college of JSS Academy of Higher Education and Research. Coming on to Sir, sharing with my audience the profile. Sir is a very passionate teacher, a committed researcher, and an able administrator. As a principal of JSS Medical College and professor of medicine, he has distinguished himself and is admired by his student and liked by his patient for his human approach. He has been awarded with 9 Oration Awards at various national and international conferences and seminars, received 4 social honors, 2 Lifetime Achievement Awards. He has been also awarded Fellowship of Indian College of Cardiology in 2015 and Fellowship of American College of Physicians in 2018. I congratulate you, sir, for all these achievements. And yes, sir. And I would like to start. And sir, the first thing which I want to ask that you have held very many key positions in your esteemed institute throughout your professional career. What are the key factors that will keep you connected with the education sector?
Thank you very much, Ankush, for a kind introduction. I'm very, very proud to say that I'm working in this institution for the last more than 3 decades. And I joined this institution as a teacher, basically as an assistant professor in medicine, way back in 1987. Then, since then, it was my passion to teach because the reflections from the students who will be your ambassador from the institution spread across the country, across the globe. Wherever I go, they say, we are all in this position because of the institution and because of your teaching. That kind of satisfaction a teacher gets is never purchasable by any means. And that gives you more impetus to continue to teach and continue to produce the leaders in healthcare industry in the world, in the country, in the state. That kind of satisfaction keeps me perpetuating, keep doing good things in planning and executing a very good quality teaching in the institution and trying to get more and more humane manpower to the society, to serve the people, and also to be a researcher and also to be a teacher across the country. That keeps me momentous to keep doing good things as a teacher. And as an administrator, I have held the positions like, first I was a unit head running the unit responsibility in the Department of Medicine. Then I was heading the Department of Medicine. Now for the last 11 years, I've been heading the institution as a principal, trying to coordinate, trying to take people forward along with me as a team. And also I am designated as Dean Faculty of Medicine, concerned with augmenting, planning and executing a great academic quality to the students across the courses like MBBS and postgraduate courses in 22 departments and allied health science, where we offer a lot of manpower creation, a quality one in 14 different BSc and MSc allied health science programs. So this is our passion to continue as a leader and administrator at various levels.
Sure, sir. Thanks for sharing your thoughts on that, sir. So, sir, like you said that you are in this industry for more than 3 decades. So, may I know what's your philosophy of leadership? How would you describe your leadership role?
Our vision statement itself, if you look at, which is there on our website, the vision statement of the institution is to provide leadership in medical education, research, and contribute to humane and cost-effective healthcare is the vision of the institution. The mission is to produce a breed of globally competent medical professionals with a strong urge to serve the humanity. The core values of the sincerity, passion towards lifelong learning, meaningful research, and patient care guided by ethics. This vision and mission statement keeps you clearly that we have to do things not just done by any other institution. We have to be different. So that difference is basically taking all the stakeholders together as a team, my teachers, my supporting staff, my management at the university level, and the spiritually guided philosophy by our Swamiji, who is the Chancellor of the university. This university is different because it is guided by a spiritual organization, not run only to make profit. It is designed to produce a quality education to the students and bring out the best in the human mankind who joins this institution with the utmost intention to become a better human being, better person in terms of education as well as quality of the human life. So the basic principle in leadership is take the people together, understand the difficulties, have a great passion to listen to their problems and try to solve amicably with the diplomacy.
Yes, sir. Thanks for sharing that, sir. So, sir, today's education system in India and other foreign countries are structured very differently.
Correct.
So, in your experience, what can an inbound student gain from studying in your college?
Now, you are rightly said, there was a lot of gap between the way the education is conducted elsewhere in the world and the way the education is done here. Now, with the new education policy, the things will be different. And we are matching in terms of structuring the education and infusing the skills and competency and assessing their competency also is falling in line with most acceptable international standards. So new education policy of the government, which has been there on the table, which will be implemented, it will be difficult to implement in total, but it will definitely be implemented over a period of time in a staggered manner. But I see that the differences between the education qualities in India, which was there when compared to other countries, is now getting narrowed. And we will be in par with them. But we at this institution and this academy are already in line with modified education system, which is different from others. We pay more attention to skill infusion. We pay more attention to competency-based education. And of course, they are all fall in line with the statutory guidelines as well as the institution policy and strategies. So that way, we are getting narrowed in terms of the quality education in par with international standards. So our students will definitely like to join here. The testimony for that is our rankings and accolades. In Times Higher Education in the world ranking, we were ranked among the top 500 universities because of the equality. Number two, in this institution itself, recently, Career 360 magazine conducted a survey and announced the results. We have been ranked 5th rank among the top private medical education institutions in the country. Outlook survey last month it was published. We have been ranked third rank among the private universities, private medical education institution in India. And national institution ranking format has given us 20th rank among all the top education institutions in medical education institutions, including AIMS. We are 20th ranked by the country, ranked by Government of India. So these are all the testimony which will definitely speak about the quality and definitely give a meaningful impetus to the students to keep looking for joining this institution, because we are driven by a quality education in this institution.
Yes, sir. I'm grateful to know all these things, sir, and I'm pretty sure it's a great learning for our students as well. So, sir, if you can share more insight into how your university could be more welcoming to students of different states, races, or economic backgrounds.
Yeah. The diversity of students and handling their needs is a very, very good strength of ours. We have a customized teaching faculty. We have a very stable student support system, very, very grand infrastructure to make suitable for many students who come from various parts of the state in this country and some of the foreign students. So this only speaks that we have a great capability of handling the diversity. We do conduct language classes for those who want to learn the local language to interact with the patients. And we have a foundation course, first 1 month, where the students are made to learn each other, mix up each other, learn the differences and difficulties. They become one, and they become they learn to live like a family belonging to same single family. So that capability of uniting them and narrowing the diversities is the greatest strength of this university and this institution. And the students are made to be part of the system, and ultimate goal is to visualize and achieve the vision and mission statement of the organization and the institution.
Sure. Okay. So you have talked about mission and vision statement. So if I may ask, what is the university's top priority for the next decade?
University is aimed to produce improvement or augmenting the academic quality in terms of not only just trying to support the government by implementing the new national education policy. Number two, we are very much there in all the three fields. One is academic knowledge transfer through the competency and the capabilities of skill. Number two, we infuse research mentality, which is the great requirement for the today, translational research, which is applicable and useful to the society. That we are augmenting, but with the industry partnership, with the exposure of the students to that kind of needs that they learn and have developed a mindset. The third is, of course, the capability to produce a manpower with all kind of requirement, like not only doctors, we have institutions with which can create all kind of healthcare need in terms of supportive healthcare systems. So that way, our university want to be one among the top 100 universities in this world in the next 10 years. And we want to be within the top 10 in the country among the medical education institutions. So these are the goals. Not only that, we want to get involved in, or get our students involved in, get our student research scholars involved in. You do run a PhD programs apart from MBBS and the master degree in the MCA permitted courses. But apart from that, we have a lot of PhD programs who are doing a lot of translation research work, which will be meaningful to the society. So with this, we want to progress in forefront in the next 10 years to be among the top 10 in the country, top 100 in the world. And we want to create manpower who can take all the three domains, the academics, the research, and the healthcare provision.
Yeah. So, sir, I was going through your profile and I saw that you really believe in empowering the youth and onboarding them, because you feel that youth is the future of the country. So any suggestion you would like to give to the current youth or the aspiring students?
No, unfortunately, there are a lot of diversity for youth. When they are young, they get attracted by many things and they get diverted. So we have to learn as an institution head or an organization heads anywhere in the country to learn and support the students and encourage their area of interest instead of trying to put them into a harsh vision. They should be encouraged to take up the diversity. That is what is there in the foreign education system. It is the driven education system to the needs and wishes of the students who are willing to happily learn. One principle in life is simple. Whatever you do, you have to do with happiness. The outcome will be very, very joyful and fruitful. Anything that is done with a force will not have a very good result or outcome. So, one simple thing that we have to learn is, if somebody is good in that particular area, in that particular profession, we have to encourage them to do well in the focused area and make them excel. So with this, we can achieve better. So we have to learn to identify the interest of the student, support them to excel in that area. That principle will make a good outcome for the students when they go out of this institution. And they will be most sought after in the society. So be it MBBS and MD, we need not make any marketing, because the students look at our ranking status, look at by words of mouth by other students. There is a lot of demand for this the demand is very high. Allied health science, we are creating such similar manpower, and they are all given a very high quality education. So maybe it is BSc and MSc programs in various courses like imaging technology, laboratory technology, then respiratory technology, dialysis technology. Then we have a Master of Public Health. These are all the additional workforce which are very much required. They should be highly skilled to support the healthcare delivery at a very, very correct level into the country. So with that way, this institution, apart from running the Medical Council of India driven courses, which are recognized for 200 MBBS admissions per year and nearly 150 postgraduates in 22 different departments, we are producing and high quality healthcare manpower. Similarly, in allied health science, as I said, we have created 15 different courses which will help in support system, which is very much required. There may be a very good doctor. If there is no good assistant to carry forward the work, your work will not be exhibited in a way that should be done. So that way, education at JSS Medical College, under JSS Academy of Higher Education Research, with the influence of our Chancellor, Sri Shivaratri Desikandra Mahaswamiji, who is always giving us a very, very spiritual influence and the guidance, we have been able to do very well.
Yeah. Thanks for such a detailed answer, sir. So, what would you like people to know, the students which come to a platform, about your university they might not be knowing right now?
Okay. Now, this young university of just 12-year-old, it was just formed in 2008. Though the institution was there existing for more than 3.5 decades, but the university came into existence only in 2008. In 12 years, we have achieved what a university of a 50-year-old could not be achieved. So that is the power with which we have been working. This institution stands for its committed fulfillment of the vision and mission statement which I have already announced, which everybody should know that we are not just making on paper vision and mission statement, we are achieving it. We are meeting the goals through a very, very strategically driven objectives and strategic plan. Our strategic plan is called as mantra. Okay, so there is an expansion for that which is there in our website. The committed faculty, excellent infrastructure, able support staff, and the proper guidance by the spiritual guidance by the Chancellor, who is the head of the academy as a Chancellor, and a very, very able leadership at the university by Vice Chancellor and Pro Chancellor. We bring it to the society, the students community, that please believe us, come here, you will be a different person when you go out of the institution. We will make you a good human being first and a good, educated, skilled individual to exhibit anywhere in the country, anywhere in the world. You will be accepted and welcomed, positioned because you have got education in this institution, in this academy. That is what I would like to say to the student community.
Thank you, sir. Thanks for answering all the questions so patiently and for all the detailed answer. And thanks for taking out time for this interview. And now I would like to end the interview and thank you, sir.
Thank you, Ankush. Thank Collegedunia for giving me this opportunity to express what we are capable of. Thank you all students, and hope we will see many good students to come here to become better person in life. Thank you all. Be happy.